Hello, this is Dr. Sanjoy Kumar Rai, Registered Medicine, Khulna Medical College Hospital. Today, I would like to talk on a rare disease, hypophosphatasia. Hypophosphatasia usually is due to deficiency of alkaline phosphatase, and it is an autosomal recessive disorder. Alkaline phosphatase, as we know, important enzyme related to bone metabolism, and it is usually increased in disorder of bones and also in cholestatic liver disease. Today, the hypophosphatasia is the metabolic disorder of bones, and it is autosomal recessive disorder, and it usually present in early of life as rickets. Sometimes when in heterozygotic form, it may present in adult life with osteomalacia and sometimes osteoporosis. Now look here, what is the pathology actually? In hypophosphatasia, there is gene mutation, loss of function mutation in TNALP, that is tumor non-specific alkaline phosphatase. This is the responsible gene which normally encode the alkaline phosphatase, and due to loss of function of this gene, the alkaline phosphatase level become very low or maybe undetectable. Now what is the function actually of this alkaline phosphatase? In bones, actually in the membrane of osteoblast, this alkaline phosphatase is present in the membrane of osteoblast and chondrocyte. The alkaline phosphatase usually responsible for the hydrolysis reaction of pyrophosphate and pyridoxal 5 phosphatase. I will talk again later about pyridoxal 5 phosphate. At first, the pyrophosphate. When the normally the alkaline phosphatase causes hydrolysis of pyrophosphate, and thereby the phosphate enter into the bones and take part in bone mineralization. And if the alkaline phosphatase is decreased, the pyrophosphate will be accumulated outside the bones, and this accumulated pyrophosphate, look at here, accumulation of pyrophosphate prevent or inhibit the bone mineralization by inhibiting the synthesis or formation of hydroxyapatite. The name of the molecule is hydroxyapatite. As we know from our biochemistry knowledge, the hydroxyapatite is the main molecule of bone mineralization. And here, due to decreased activity of alkaline phosphatase, the pyrophosphate is deposited, and these deposited pyrophosphate inhibit the formation of hydroxyapatite, that means inhibit the bone mineralization. So bones become very soft, and also calcification of cartilage, that is called chondrocalcification. Okay, so as a whole, the condition present as rickets and chondrocalcinosis. And how to suspect that the baby suffering from hypophosphatasia? Usually the baby present with loss of baby teeth very early, around 6, 8, 9, 11, 12, 15 months, very early. So loss of baby teeth, it is the very pathognomic clinical features of hypophosphatasia. Now, how a patient sometimes may present as a seizure or convulsion? How? Okay, for that look at here the pyridoxal 5 phosphate. Actually vitamin B6 is related here. Vitamin B6 has three main form. Number 1, pyridoxine, number 2, pyridoxal, and number 3, pyridoxamine. These pyridoxine, pyridoxal, and pyridoxamine, all these three are phosphorylated to form pyridoxal 5' phosphate. PLP, this is called PLP, pyridoxal 5 phosphate. This is the phosphorylated form of vitamin B6. Okay, and this vitamin B6, that is PLP, has many function, and most importantly, it is related with the synthesis of neurotransmitter in the brain. And to take part in the synthesis of neurotransmitter in the neuron, it has to be at first dephosphorylated by the alkaline phosphatase. I repeat again, to take part in the synthesis of neurotransmitter inside the neuron in the brain, at first the phosphorylated pyridoxal 5 phosphate must be dephosphorylated by the alkaline phosphatase. So if the alkaline phosphatase activity is decreased, dephosphorylation of pyridoxal 5 phosphate will be decreased. So entry of pyridoxal 5 phosphate inside the neuron of the brain will be decreased. So neurotransmitter synthesis will be decreased, and these decreased neurotransmitter synthesis in the neuron will be responsible for convulsion. So the baby present clinically as the feature of rickets, like soft fragile bones, very easy fracture with rickety rosary, convulsion, and loss of baby teeth, the most important finding. So this is the biochemical correlation of alkaline phosphatase with pyrophosphate, which is actually responsible for bone mineralization, and pyridoxal 5 phosphate, it is the phosphorylated form of vitamin B6, which is responsible for neurotransmitter synthesis, and due to decreased neurotransmitter, patient present with frequent convulsion. Okay, now how will you investigate this problem? Serum alkaline phosphatase, number 1 investigation, which will be very low or maybe undetected. Okay, on the other hand, the calcium phosphate, parathyroid hormone, and vitamin D, these 4 components will be very normal. As we know, in the diagnosis of any metabolic bone disorder, these are the investigation of choice: alkaline phosphatase, calcium with albumin. Of course, albumin should be measured along with calcium. However, serum alkaline phosphatase, calcium, phosphate, albumin, parathyroid hormone, and vitamin D, these are the panel of investigation to diagnose metabolic bone disorder. So here in hypophosphatasia, the serum alkaline phosphatase is undetectable. On the other hand, all other investigation here are quite normal. Okay, and finally, the urinary excretion of pyridoxal 5 phosphate and phospho-ethanolamine found increase. As due to decreased activity of alkaline phosphatase, the pyridoxal 5 phosphate, that is PLP, remain unused, and this unused pyridoxal 5 phosphate is excreted through the kidney. So urinary level of pyridoxal 5 phosphate will be high. And phospho-ethanolamine, this is actually the substrate of alkaline phosphatase. Okay, as the alkaline phosphatase level is decreased, so its substrate remain high, and this high substrate phospho-ethanolamine is excreted through the urine. So urinary level of these 2 components will be high. Now come to the point of treatment. How will you treat this patient? And nowadays, the hypophosphatasia is treated with recombinant alkaline phosphatase therapy. It is one type of enzyme therapy. Okay, enzyme therapy, and the recombinant alkaline phosphatase is called aspartate alpha. Okay, aspartate alpha. You have to keep your mind with this term, aspartate alpha. And this recombinant ALP therapy is very much curative, and the baby should be follow-up monitored annually. Okay, so this is all about hypophosphatasia. Hope this will be enjoyable for you. If you think this type of medical video is helpful for you, you may subscribe this channel. Thank you.